Pulmonary embolism is a clot that forms in the pulmonary arteries. There are major vessels that connect to the heart. It's quite dangerous because it can actually cause significant shortness of breath, significant cardiac and pulmonary problems. There are several risk factors for pulmonary embolism. This would include hospitalization, surgery, stroke, cancer, maybe significant inactivity, and in addition to that, patients who have a prior history of deep vein thrombosis and pulmonary embolism, severe infection, certain congenital or inherited disorders of the blood clots that can put these patients at increased risk of developing pulmonary embolism. The reason why these patients are at risk of developing pulmonary embolism is that because of what we call blood stasis or inactivity of the blood. There is a slowing of blood flow usually in the lower extremities, the legs, of that patient that causes the patient to be at increased risk of developing clots. Most clots form in the legs, in the venous system in the legs, and we call them deep vein thrombosis. These clots can take off at any time and travel to the lungs through different blood vessels and settle in the lung to cause pulmonary embolism. Pulmonary embolism can present with different types of symptoms. The most common one is shortness of breath that can occur on exertion, for example, or even at rest. Chest pain, especially chest pain on deep inhalation, is common in patients with pulmonary embolism. Other symptoms that sometimes we encounter are things like blood-tinged sputum, things like maybe irregular heartbeats patients may have, and symptoms that are related to the clots forming in the legs, such as pain and swelling. Patients who are experiencing symptoms of shortness of breath, chest pain, for example, should go immediately to the emergency room or contact their doctor. When they get to the emergency room staff will start what we call a workup to detect a pulmonary embolism. This may involve taking a history and physical of the patient, getting some blood tests done that can help in detecting the pulmonary embolism, as well usually doing some x-rays. The most common type of x-rays that we do to diagnose pulmonary embolism is a CAT scan that involves giving also contrast or dye to detect the clots in the pulmonary arteries. Once the diagnosis is established, the emergency room staff usually will start treatment. The treatment involves helping the symptoms, such as giving oxygen therapy, for example, but the most specific treatment is giving the patient blood thinner. The blood thinner will actually prevent further clots from happening while allowing the body to dissolve the clots that have already formed. In some circumstances where the clot burden is quite significant and the patient is quite symptomatic, and maybe they have a low blood pressure, for example, there are some additional treatment that are called clot buster medications that can be given to such patient to dissolve the clot quickly, and these are considered life-saving medications. In very unusual circumstances, in patients who are at a very high risk of bleeding, other considerations that does not necessarily include medication will be explored by the staff. And these type of treatment may involve surgery to remove the clot or using special catheters to remove these clots from the pulmonary arteries.